Hello, 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 everyone. It's Dr. Tamara Beckford with the Dr. Tamara Beckford Show. I am excited. Here we're having one of, this is an honorary doc. And she's looking at her, she's going to be like, really? Absolutely. I'm so excited to have her on here today. We are going to be talking about her journey. This is one of our queens coming out of South Africa. She is South Africa's youngest female medical doctor, graduating at the age of 21. So we're going to learn all about her journey. So for those of you guys who are ready to be inspired, here it is. Talk about the good, the bad, and the in between, because everything is not roses, right? So we have some good, bad, and in between. Alrighty, so this wonderful doc of ours, she graduated, actually, she started at the age of 16 because she received the bursary from the Industrial Development Corporation, which is the IDC, and she enrolled at the University of Witwatersrand. Now, I tried to pronounce that prior to coming on. So all of our people from the University of Witwatersrand, let me know how I did. Did I get an 80%, 95? How close am I? Or was I like closer to the 15%? You let me know. She went there to study medicine. At the age of 21, she graduated with a bachelor's of medicine and a bachelor's of surgery from University of Wits. That's our Wits University. That's the shortened for that. She was inducted into the Golden Key International Honor Society. So all our Golden Key members, yes, from all over the world, yes, while she was in university. In 2022, she was honored among the 200 young South Africans by Mail and Guardian show because of her care and compassion and her impart in the potential of being able to make such an impact on the global stage. Now, with the ups, we do have some challenges that occur. So some of the challenges that we're going to talk about today is the unemployment that's faced by not only her, but over 800 other doctors in South Africa. You know, she has the drive, she's willing to work, she has the passion, but of course, not being able to do what you love can sometimes have an impact on your well-being. And we're going to go about all of that today. So now, who am I talking about? The one, the only, Dr. Thakgalo Thibela. Hey, we affectionately call you Dr. TK. Hello, Dr. TK. How are you?
I'm good, thanks. And how are you, Dr. Tamara?
I am doing well. Alrighty, I'm excited to hear about your journey, as are many who have really been watching you. Some they've never heard about you, but then some will understand because the journey is universal. The journey of medicine is universal. There are the ups, the downs, and the in betweens. Alrighty, so with that in mind, I'm gonna take you all the way back when you decided that you wanted to become a doctor. Let us know, when did that happen?
Whew. As far as I remember, like since I was in preschool, maybe like 5, 6, 7, I've always wanted to be a doctor.
Mm-hmm.
Obviously, I didn't know what it meant to be a doctor back then,
Mm-hmm.
but I knew that is what I wanted. And I remember every time we'd go to our family doctor, I'd like look at him with such admiration. I'm like, one day it's gonna be me.
That's gonna be me.
Yes, and I just went through like school with that in mind. And I remember when I was in the 11th grade,
Mm-hmm.
one of my math teachers actually came to me and he was like, "You wanted to be a doctor, right?" I'm like, "Yes." And he's like, "Okay, there's this field that hasn't been really explored by a lot of people. It's called neurosurgery. You should maybe look into that." And I didn't know what was neurosurgery at the time, but I was like,
Yes.
we'll see, maybe. But yeah, so it has been a dream, for as long as I can remember. And for
Mm-hmm.
me, it feels like it is something that God had placed in my heart for me to do
Mm-hmm.
because from a tender age, I've always had the need, like, or the passion rather, to help people. And
Mm-hmm.
figuring out how to do that. You can help people financially, you can help
Yes.
people by giving them advice, but I felt I'm supposed to help people by taking care of their health, mental,
Mm-hmm.
physical, everything. And this has actually given me that opportunity to do exactly that, and I'm very grateful for it.
Love it. So at the age of 5 or 6, you're there looking and you're like, I like this person who's taking care of others and they're so helpful and you're making them well. That's going to be me. So now we're talking about like neurosurgery. Okay. So when you went into medical school, did you go in saying, yeah, I want to do neurosurgery? Or was it, let me just see what this thing's about and what I do like? Tell me.
So before I start talking about that, before I got into med school,
Mhm.
um, there were a bit of challenges there as well. So
Hey, we all go through it. Tell us.
I applied to, I don't even remember how many medical schools I applied to. And I was initially not accepted by any. And that for me was, oh,
Heartbreaking.
oh, it was really tough because I remember I kept getting these emails one after the other, one after the other. And I was like, okay, but why? Because I felt like this is what I'm supposed to do.
Yeah,
And
this
I've
is
worked
your calling.
all my life to get to this point, and now I can't do it. And I remember I was crying. It was a Friday afternoon, and at like 5 p.m., I get a call. I see it's an office number, and I'm like, 5 p.m. on a Friday, officers, what's going on? And this lady was like, hey, we're reviewing your application, and we just want to invite you to come register on Monday. And I remember thinking, this must be a scam because and then when I told my parents about it, my dad was like, are you sure? I'm like, I don't know, but that's what it said. So
Yes.
on the Monday, we drove to the university, and I remember I was so nervous when I was going into the registration hall because it's like, what if it's not true? What if I get in? They're like, what are you doing here? Like, what's going
Mm-hmm.
on? And
Yeah.
I got there, first station, they checked my details, and like, oh, actually, you were accepted for medicine. I was like,
Wow.
okay. But even then, I still didn't believe it until I actually had, my student card and everything on hand. I'm like, okay, so this is actually happening. So yeah, no, that was a surreal moment for me. I was like, okay, you know what? Patience. God knows what He's
Yes.
doing. So just trust Him.
So
And
I have a question about that time. Was it still within that same first rounds of application to many, many universities that you got accepted, or was it I've sent out many applications and then now I have to wait until next year to send out applications again and then got accepted? Which one was this?
oh, so it was the first round. So how we do
Ah.
it here is you apply while you're still in the 12th grade, and
Mm-hmm.
they wait for your final high school results to
Ooh.
accept you or not. Yeah. So I had to wait because university started in February that year. I remember. So they started like sending out these emails in January after we got our results, and I was like, oh, okay, I guess this is it.
Oh
But this
no.
a week before, few days before, I got in, and I'm still grateful that that happened.
Oh, okay. Alrighty. I cannot imagine. Actually, I can because I recognize. I remember my first set. I didn't get in, and I was like, "So you were talking about the emails? I had the envelopes. When you keep,
Mm.
I know when you're ripping the envelopes, and you're just like,
Mm.
So I'm pretty sure it was the same with the emails. That weighted feeling, like, oh my gosh. So then
Yep.
that last one, when I always tell, like, now for those who are applying to med school, like, some of the students that I mentor or I'll talk to along the way, I was like, it just takes one. It
Mm.
just takes one. Like, as soon as you get one, then you can just feel the weight just coming off because now you're going to be on that journey. It just takes one. So I cannot imagine how you felt at that. Finally.
Yeah.
So now you got your card. So they said, okay, it really is you. You do have a spot here. Yes, this is true. Classes start on Monday. So tell us
Yeah.
about that part of the journey. How did that part feel? Like, what was going through your mind?
Honestly, it took time to really set in, because I had all these feelings of self doubt, and it just made me feel like the fact that they waited so long maybe means, maybe I wasn't competitive enough, or
Ah.
they just had an extra sport that someone declined. They're like, let's just give it to this person. So I remember the first couple of years of medical school, I had this extremely low self-esteem, and I just felt like
Mm.
I didn't belong. I just felt
Mm.
like, someone decided, let's just, but we know she doesn't really, but let's just. So
Yes.
it was really, really difficult. And getting out of that took, it took a lot. It took a lot of my seniors speaking to me. They're like, no, listen, we know, we can see that you know what you're doing.
Mm-hmm.
Yes, you just need to be confident, because medicine requires confidence. You can
Mm-hmm.
be confident and be talking things that don't make sense, but as long as you're confident, people trust you. So just try. We know it's difficult, but just try, express yourself more,
Mm-hmm.
and you'll be fine. And I think I was only able to do that in my fifth year of medical school. So
Yeah.
4 years of medical school was just me feeling like I was worthy, feeling that they made a mistake, and they'll call
Mm-hmm.
me and be like, "Oh, by the way, so sorry, but we made a mistake." So yeah.
I think a lot of us in medicine had, or I say in medicine, but also when I think about professional schools overall, we all go in with a lot of doubt because
Mm.
we're amongst the best of the best in the entire field. And you always feel like, I don't know about you, but I'd sometimes get that dream that I got this letter that said, oh, it was a mistake,
Mm.
and I'm like, oh, the walk of shame, having to walk out of the medical school. I mean, it's just like, but I'm glad that you're talking about it because there are other people who are in these professional schools. They're in the medical school, they're in law school, engineering, and they feel like it's a fluke. And it's
Mm.
not a fluke. You really put the work in and you belong. You belong. You said it took you almost 5 years to develop the confidence. Now, if you think about it, 5 years of taking exams, passing the exams, moving on to the next level, taking those exams, passing them, moving on to the next level, and still having doubts.
Yeah, I don't know. Like even now, when I think about it, I really don't know why I was feeling that way. Because after my first year was when I got invited to join the Golden Key. And not everyone gets invited to join that. So
No, that's an honor society.
but even then, I was like, I don't know, maybe they also just fell for me, and they're like, might as well. So yeah, no, it really took a lot for me. Even now, I'm still learning to be more confident in myself and trust in my abilities. But yeah, it's not an easy thing. Really
No.
hasn't been easy.
No. And you're saying this like, in your 20s, and there's still people in their 30s, 40s, and 50s that are still developing their confidence in recognizing that what I'm doing is not only that I'm meant to do it, but I am capable of doing it and I have the skill set to do it. This is not a fluke, you know? And like, it's not something that's happening by happenstance. I earned this. And so this is so funny. I started saying the word instead of deserve, I stopped saying deserve when it came to, getting awards and so on, because you earned all of this. And so I'll say, oh my God, you have earned this. So I'm glad that we're talking about that. So after this entire process, your schooling, there's the didactic parts and then you have the clinical portions. Tell us, how was your transition from the didactic to the clinical? Because I tell you, me, I screwed up royally during that time. But that's for another day. You tell me about you.
So the first 4 years is the didactic. So you're in lectures all day, every day. And then the last 2 years is clinical. So in the third and fourth year of medical school, you do get to go to the hospital, but to just like shadow, you don't really get engaged like that.
Mhm.
Yeah, fifth year, that's when we start going to we do our clinicals. And my first rotation in fifth year, I remember was urology. And I remember I was in this ward, and you never really know what to expect. You try study as much as you can so you're able to answer all these questions that they can potentially ask you, and you're hoping the surgeons are nice because you don't want to try like make them angry and then they start shouting at you. You make you feel like you don't know what you're talking about.
Yes.
So yeah, it was very intimidating, and I was so nervous. I'm like, oh my god, then please let them not ask me something I don't know. Can I please know the answers to everything they ask me because I don't want to look stupid. Yeah, so it was very intimidating, but it was better for me because the group of people I was placed in the rotation with were people I had known in the first year. So it made
Oh,
it a little easier because you're like, "Ah, we know you know these things. It's just nerves because there's like
yes.
people who know more than you around." So that really did help me. And actually, one of my closest friends was with me. I met her on the first day of medical school. We still friends.
Mm.
So she's always been that person that was like, "That's fine, you got this,"
Yes.
and it made it made a whole lot of a difference. But even then, I was still very very shy. I never spoke unless spoken to. Even when they asked questions to the group, I
Mm-hmm.
would keep quiet unless they asked me directly.
Oh,
And
wow.
it was in that year that one of the surgeons, we were doing general surgery. One of the surgeons literally pointed to me and she was like, I can see you whispering the answers. And I was like, oh my God, I thought I wasn't being loud. She was like, no, speak up. And I spoke, and she's like, see, what are you scared of? Because you know what you're talking about. You just need to be more confident in yourself because people won't take you seriously if you're not confident.
Mm-hmm.
So yeah, that was the beginning for me. So unfortunately, in our second year of clinical, so our final year of medical school, that's when COVID hit,
Mm.
and we had to go back home. They tried doing like online. It wasn't really working.
Mm-hmm.
Went back to medical school after like a month and a few weeks of being at home. Now you have to try a simulate. Now there's like distance learning. You can't be touch patients. You can't do this. You can't do that. That was really really tricky to navigate, and the fact that for us, so after you do your medical school, you do internship. So in internship, you rotate through different specialities, and
Mm-hmm.
you're expected to at least know the basics. So
Mm-hmm.
there was that fear that, oh my God, we won't be good enough as interns next year because we're not being able to do all of
Yes,
these
'cause
things.
you're missing out.
Yes, yes, yes. And even with our clinical exams that year, some were just didactic,
Mm-hmm.
but some were clinical. Um, but yeah, so clinical years were fun. They're only fun because, like I said, of my group of friends. We
Yes.
were together. But I think it was in my final year that I started realizing what I'd want to go into.
Mm-hmm.
So, as much as neurosurgery has been a thing that I was told back in high school, I had never really thought about it until like about second year of medical school.
Okay.
And the thing that even made me consider it was I remember we were doing anatomy, we were in the anatomy lab doing dissections, and it was cool. You open the thorax, you see the heart, you hold it, you're like, okay, hold the lungs, hold everything. And I remember when we now did head and neck, and we were holding the brain, and I was like, hmm, you know, at least for now, this is the only organ that you can't hold. Like you can't hold your own brain. You can hold
Right.
your own because they can transplant it, your liver, your kidneys, whatever. But your brain, you
That
can't
is
hold
true.
it. And that just fascinated me. I'm like, maybe there's something with this neurosurgery. Maybe I should
Yes.
actually look into it. And I really enjoyed neuroanatomy in that year as well, and I was like, maybe we're getting somewhere. So
Mm-hmm.
even when I did my surgical rotations, even though they were not subspecialized, so the only
Mm-hmm.
subspecialty in surgery was urology, ENT, ophthalm, but we didn't do neurosurgery or cardiothoracics or anything like that. So I didn't really get a feel of it. But
Mm-hmm.
even during surgery, I was like, yeah, this is something I could do. But more so the brain and the spine were my fascination.
Ah.
Um, yeah, so that is where it starts at just holding someone's brain. And I'm like, okay, there's something to this.
When I sit and think about like this whole journey and how the importance of number one, being around people who can help you along the way, that support system, like how powerful it, because their support system was not just there to help with studying, but it's an encouragement to help you build your confidence because you knew your information, but you are whispering it. Luckily, that surgeons, they're like, I see you whispering the answers. You're whispering it, but then also developing that confidence and being around people that can see in you what you don't see within yourself. Number
Mm,
one, that went all the way back to that seed that was planted by saying,
mhm,
there's a field out here that
mhm,
is available, and there aren't a lot of people in that field here. Because the
mhm.
the time between when that seed was planted in your brain and you actually picking up a brain were many years. And you still did rotations. And I mean, that wasn't the first time that you were looking at pictures of the brain,
Yeah.
but the seed was planted and it started to get water and developed,
Mhm,
and the team and your support system it's helping you to also develop. You're developing
mhm.
your confidence, and now you're there. So the pandemic hit, and for the pandemic, it changed a lot in the way for you. You were still in training, you were still learning. So how did it progress for you with your training?
So in 2021, I was doing my internship. So it's a 2 year long program.
Mm-hmm.
My first rotation was surgery. I was looking forward to it. I was very excited about surgery. But unfortunately, because of the pandemic, we didn't really get to be hands on in theater and
Hands-on.
all of that. Yeah, they were only doing elective cases, and even then, the electives were like there and there.
Mm-hmm.
Um, so I didn't really get as much surgical experience as I would have liked to.
Mm-hmm.
But during the surgery rotation, we were doing trauma calls on the ED. So that was fun.
I'm an
um,
ED doc, so I understand.
I actually remember my very first call. So we started work on the 1st of January.
Mm-hmm. Oh, New
Um,
Year's Day?
yes.
I'm laughing with you.
So I remember I was doing a trauma call and I was in the ED and I'm like, oh my God, fresh out of med school, I don't know what I'm doing. I just hope the people that are here with me will like help me navigate
Mm-hmm.
my way around. And I remember I got there. There were very amazing doctors that I was working with that day. And fortunately, it wasn't that busy, so there was time to teach and everything. And the first patient I saw was this lady. She was like middle aged. She came in with a laceration on her leg, and they're like, "Oh, TK, yeah, that's your patient. Go take history, examine suture, whatever." I'm like, the last time I sutured was on practicing. I've never actually sutured a real person before. But it's fine. We got this. We
Yes,
got
you got
this.
this.
So I'll go there. I start talking to this lady. We have nice conversation. I'm like, okay, I'm gonna start doing the work now. I'm gonna suture you, okay? She's like, okay, no, go ahead. So I'm there, I numb the area, it's clean and everything. I start suturing. We're talking throughout this whole conversation, and I'm also like, oh my God, I hope I'm doing it right. I hope I'm doing it right. Just praying internally that I'm doing it right. To my surprise, after the whole ordeal, she goes and speaks to my seniors in ED. She's like, God bless the doctor. She treated me so nicely. I didn't even
Oh,
when she was suturing. she's gonna be a good doctor. And for me, that was also like I needed to hear that. I needed to
Absolutely.
hear that because I wasn't sure what I was doing. And
Mm-hmm.
that reaffirmed that this is where I need to be. This is what
Yes.
I should be doing. And I've been carrying that since. I still remember her to this day. She
Oh,
really just started my career, if we can put it that.
yes.
So, yeah.
The affirmation, and that's what you'll always get into situations where you're feeling uncomfortable. You're wondering, all the knowledge that I have in my head, is this true knowledge or did I make this up? Whew,
Mm,
I feel nervous. But, and I remember, I think it was one of my ED attendings, and they talked about the training process and the reason why you put in all that work ahead of time. Because when your nerves kick in, when it's the middle of the night and you're just woken up, your
mm,
knowledge is there, and so you're not trying to pull from anything, it's there at baseline. So for you, yes, the nerves were kicking in. You were there wondering if I'm doing it right, but you were holding the suture kit, you had the sutures, and you had, your forceps, scissors, whatever it is. You obviously made that person feel comfortable enough that not only did she say, "Oh, thank you so much," and left, but she went and spoke to your seniors about you. So I'm glad that that brought in that added level of security and confidence to get
mhm.
you through, and to even to this day, whenever that doubt comes in, she's gonna be a great doctor. So I am a great doctor, right? You can
Yes.
say that to yourself. Alrighty. So now throughout this entire time, you're in school, training, and so on. Have you ever experienced what we're really talking about a lot now in medicine and in life, which is burnout? Have you ever experienced the burnout?
I have, and I think the peak of my burnout was during COVID as an intern, and it
Mm-hmm.
was during my internal medicine rotation. So,
Mm-hmm.
how it happened with us was that you were an intern paired with a registrar, so resident.
Mm-hmm.
So you have patients together. So you can
Yeah.
have as little as four, as many as 40, but those are your babies. You have to see them every day. And
Mm-hmm.
with us, you also do the ward work. So you have to take the bloods, put up the IV lines, do the LPs, do the bone marrows, do everything, order the scans, everything. So
Mm-hmm.
yeah, sometimes you have 40 patients and you round through all of them and they all need all of these things and you have to do all of these things and you find that you've been there since like 6:37 in the morning and you're only leaving at 8 p.m. because you had so much to do. The next day
Mm-hmm.
you're on call, you have to.
And you're staying
So
in the hospital overnight because now you're on call.
yes, and on top of that, because it was during the pandemic, you see all these people coming in,
Yes.
and there's like limited resources, limited supply, so you have to rational, you have to decide who gets what and all of that, and it was just emotionally exhausting as well because you just see all these people dying that shouldn't be dying, but
Mm-hmm.
it's just because you don't have the resources to help everyone. And on top of that, your patient list is also piling, and you're trying
Mm-hmm.
to like do your best to make sure everyone gets the best treatment they deserve, but the time is just not on your side. So you end up
Absolutely.
sacrificing your own physical well-being, your own mental well-being, your own emotional well-being. You just get drained. And by the time you move on to the next rotation, you just like, oh my God, can this year just end? Can I just go
Yes.
on vacation? Can I just say, yeah, no, burnout is real.
Yeah.
It's
And if
real.
you're thinking about, even with all of that during the time, as you mentioned, during the pandemic, where are you going to go? Which vacation?
Right?
You know what I mean? Like, so it was just like a never ending. So
Yeah.
you're doing this, and yes, you want the time off, but and so a lot of times people are just like, well, what is the point of me? Like, yes, I'm going to rest, but
Mhm.
then, as you mentioned, the sacrifice in your own well-being, your own time, your body, so
Mhm.
you said, well, I might as well just go to work because other people need me. I rested for 2 days. I feel a little bit better, which is not what burnout does, right? When you 2 days of rest is not a little bit better, but you're like, I feel a little bit better. Well, I might as well just go back and help, which, adds to everything else near when you're piled on more emotional and physical exhaustion, which adds to the worsening of the burnout. But then you also feel guilty because you're like, they need my help.
Yeah, that is very true.
So I can see how during that time, that was like in a very traumatic time for everyone, but for those especially who were in training and those who, yeah, because you had no choice. Plus, you're thinking, I know and when I was in training, I wanted to gather as much information as possible because once I left, I knew I was on my own.
Yes.
So, that also adds a layer of that insecurity and that fear that goes on. Alrighty, so now you finished training and you're out there. So tell us, you mentioned, there's some challenging times that's ahead, that unemployment, occurred. And, so tell us, when did that part happen? Was it right after training? Did you start to work and then unemployment happened? Or was it just after training, there were no jobs available? Let us know how it happened.
Yes. So, like I was saying, we do 2 years of mandatory internship, and then after that, you do 1 year of community service. So during community service, you can be placed anywhere in the country. You can be in the rural somewhere where you're one of two doctors, or even the only doctor, or
Mm-hmm.
you can still be in a training institution, which is a little bit better, but the patient load is a lot there.
Yeah.
Um, yeah, so after those 3 years of training, then you become what we call an independent practitioner.
Mm-hmm.
So, as an independent practitioner, you can decide to work as a general practitioner, or you can decide to be a specialist, or you can work in those peripheral hospitals where you work in a certain department, but you're not really a specialist in that department.
Mm.
Um, yes, so those are the options that are available to us after training. So I completed my community service in December of 2023. So this is my second year of unemployment.
Mm-hmm.
Um, and what usually happened back in the day is after your community service, the hospital you were working at, if they had a need, would keep you.
Mm-hmm.
Or if you wanted to go specialize or you wanted a change of location, you can apply to a different place and they'll take you there as well. But what has been happening over the years is that the country has been producing quite a number of medical doctors, but they're not able to place them accordingly. So we have different programs. We have us who train in the country. We have our colleagues who train in Cuba and Russia and China, and they all come back after the training and need to be placed.
Mm-hmm.
Uh, and that has posed the big challenge. So this is the first year where there has been a huge amount of unemployed doctors. So
Wow.
unemployment has been there throughout the years, but it hasn't been to this extent. And
Mm-hmm.
usually when it was there, people would be unemployed for like a month or two at the most, and then they'll get employment. But now we find ourselves in a position where we've been told, in April you'll get employed. Um, but you also have to decide on this employment that they're talking about. Is it permanent employment? Is it,
Oh, wow.
temporary? Is it like, what is it? How is it gonna be? Because the government keeps telling us that they have financial difficulties at the moment. So they had to try find this money that will be employing us in April.
Mm.
Even then, it's not enough money. So they will employ us, but whether it's on a permanent or temporary basis, that is yet to be decided. So they're now even trying to move away from the normal, your 7 to 4, normal working hours to shift work basis, just so they
Mm-hmm.
can accommodate all of us. And that also has its own problems. I'm not going to go more into it, but the main challenge that I think, the main challenge that I foresee is, especially in training institutions,
Mm-hmm.
how that would really be beneficial For example, if I come in and work from 7 a.m. to 7 p.m., I will have, consultant cover, registrar cover. I'll see a lot of day-to-day cases. But when I come from 7 p.m. to 7 a.m., I'm only seeing emergencies at that time. So my teaching during that time is very limited. My learning is very limited. So
Mm-hmm.
yeah, we're yet to see how that is going to work. But like I said, we also have the option of opening up our own practices, but that requires money.
Yes.
Yes, and it's money that we currently don't have, unfortunately.
Mhm.
The other option is to work in private hospitals. So you work in their emergency departments, but 800 of us, how many private hospitals are there?
Yeah,
So
and how many spots do they have available?
exactly.
So it's
So
800 now, but then there's another crew that's graduating soon, right?
yes,
So
so there's actually people who are finishing now in Feb, the others finishing in March, others finishing in April. So yeah, it's been
so the supply and the demand now. So you have so many doctors that, so what are the doctors doing? What other option for us here in the US? So I can only speak from this perspective. We graduate from medical school with at least $200,000 in debt.
mm,
Yeah. So and there's still some doctors here who are, finding the same challenge. Like they can't get into the training program to get the, which would be the residency program. So you graduated from medical school, can't
mhm,
get into residency to do your training, and therefore you can't work as a medical doctor.
mm.
So I know. I know. I saw the weight on your face. But with that in mind, though, the loans are still expected to be paid.
Mhm.
People still expect to live.
Yes.
Life is still going on. You're starting families and so on. So, what are some of the decisions that some of your colleagues are doing during this time?
So most of the ones I know are working in the private emergency rooms.
Mm-hmm.
Some are assisting specialists. So when they're doing cases in theater, they are their assistants.
Okay.
Some are assisting general practitioners. So let's say this week the doctor wants to go away, so you can fill in for them for that week or that day or whatever.
Mm-hmm.
But those are the only options available to us, really.
Mm.
Yeah, other than that, there's really not much else we can do.
And that's
So
just like here and there money, right?
yes, yes. We also have the same challenges you have there in terms of debt and all. I was fortunate that I got sponsored throughout medical school because,
Mm-hmm.
yeah, medical school is very expensive.
Yes,
Uh,
ma'am.
yes, but the other I guess upside that we have over you guys is, like I said, the government does sponsor our training.
Mm-hmm.
So most of the people have been sponsored throughout medical school by a specific province.
Mm-hmm.
So after they finish medical school and after they do their compulsory training, they have to go back to that province and serve for the amount of years they were sponsored at medical school. The
Okay.
challenge with that is that they are also affected in our current unemployment crisis. Because
Really?
now, yes, because now even the provinces don't have the funds to employ them. So
Wow.
they're just sitting and waiting for the province to have posts for them.
Mm-hmm.
Because sometimes the province can even release them from the obligations and tell them, you know what, we can't afford to employ you, go find employment elsewhere. But other times they have to wait it out.
And
Wait
still,
until,
once they get in, they're still obligated to the time frame.
yes.
That's hard.
Yeah, it's very challenging. Like today, we have a group for unemployed doctors. So
Mm-hmm.
today, they were making a joke about how our governing body
Mm-hmm.
sent out emails saying we have to pay our fees to be registered for this year by the end of April.
Mm-hmm.
And we were like, oh, this is so and games, you know. Yeah, we're supposed to pay to keep working when we're not working.
Good.
Well, how are we supposed to get the money to pay these fees? Like, okay, no.
Yes, the irony, the
Yeah.
irony. Wow. So here in the United States, I'm just introducing this. There are a couple different models in healthcare that a lot of physicians are starting to adopt. So, here we do have, like you said, some of the private hospitals, we do have the community, we have the university or academic based, and then there are doctors who work in those. And then you have doctors who are private doctors, and they take the insurance based model. But then there are a few doctors now that are doing models, which is called direct care models, where they've opened up practices where they only take cash base.
Hmm.
Yeah. So that model is they do cash base for primary, and there are a few doctors too who are doing cash base for surgical specialties, which is super very rare. So this is a new phenomenon, and I'm honored to be among some of those docs who are ventured into this newer model of what they call DPC, direct, for the ones who are taking direct primary care, which is DPC model, or the DSC model, which is the direct surgical care model. So for those who've never heard of this, this is a model that's out there. So they'll do it based on the need. They'll be able to provide the care that they want to the patient populations, and the patient will just pay a direct fee for a certain period of time, depending on how that physician wants to model their service. Putting it out there. Don't know if it'll work for you, but options. Yeah, it's a different system, and I don't know how this system here would work, where you are, but these are options that some of your colleagues, because we're all unified brothers and sisters in medicine. We're in different locations, but these are what some of your colleagues are doing in other countries. So,
So actually, with us, the general practitioners are doing exactly that. So they
mhm,
take both cash and health insurance. So
mhm,
yeah, because unfortunately, majority of people in South Africa cannot afford to have health insurance. So, and the GPs do cater for that majority. So they
mhm,
do accept cash too. So at least they can get medical attention when it's needed.
absolutely. The surgeons are doing it too. I know you're like, how? We'll connect you with somebody that you guys to talk about it.
Now I'm not sure if we're doing that.
Yes, yes. I'm part of the group that our answer always ends with yet. Hmm.
Mm.
So I love it. Alrighty. So now what's next for you when you think about this whole process? What's next for you?
Ooh, honestly, thinking about what's next is a bit stressful.
Mhm,
So I have applied to a few places,
mhm,
hoping to hear back soon, especially since we were promised jobs by the 1st of April.
mhm.
So hopefully, I'm one of the people that does get a
That you'll be
job.
able to. Mhm.
um,
Absolutely.
but at this point in time, I'm not in a rush, if I'm being honest. So
Mhm,
whatever I can get, wherever I can assist, I'm happy to do that.
mhm,
And God's timing is the best. So if He feels like I need to be in emergency medicine for now, be in pediatrics, anesthesia, wherever,
mhm,
I'm okay with that. And we'll see. But I've also been looking at other countries
mhm,
and kind of see where I would fit in, what the
mhm.
different countries offer. I'm a South African. I love my country, and unless I have to, I don't want to leave.
I understand.
If it means for me to advance my career, I might have to go and then come back. Then that's something I'm considering as well. But for now, I'm waiting to see what South Africa has to offer, and then I'll take it from there.
Wonderful. Alrighty, so here's my fun question of the day. Alrighty. So, other than medicine, if you were to do something else, what would it be? And it can't be anything in medicine. So don't say like, oh, I'd be an anesthesiologist. Oh, I'd be a pediatrician because I love babies. I'd start drawing pictures of the brain because I love neuroscience. Nope. What would you do?
Oh, I think about that a lot, especially after a rough call, and I'm like,
I
so.
love it.
My older sister is an electrical engineer.
Uh-huh.
Um, my younger sister is also in school for electrical engineering. So
Wait a minute. So you have they're shocking between. So you have old.
yeah, I have an older and a younger. So I'm the odd one out. And before I got accepted for medicine, I was actually accepted for nuclear science and engineering. So sometimes I think about it. I'm like, I wonder how I would have turned out if I actually decided to do that. But then I step back into reality and I'm like, yeah, you would have survived. It's shame because I really feel like this is the only thing I can do.
Alrighty, I'm going to give you some answers that some of our other colleagues have given. So
Okay.
I'll tell you who I am, and then you can decide. So I'm a backup dancer for Beyonce. She doesn't know that yet. So I'm way, way, way in the back. Like, yeah. But she doesn't know. Beyonce doesn't know I'm her backup dancer. So I think me and one of my best friends, we're both her backup dancers. My best friend can dance a lot better than I can. And then we've had some doctors who are forest rangers. We have some who will open pastry shops, internal decorators or interior designers. We've had travel journalists. We've had a someone closer to your civil engineer type thing. So someone that was doing civil engineering, parks and ranges. We've had some who are florists, floral designs. So I'm trying to fit you into my utopia. You're electrical engineering.
Okay, the one thing that I do that people say I do well is crocheting. I crocheted a dress for my little sister and she loved it. And
Oh,
she liked it.
nice.
And they're like, oh, you should do
Okay.
this more. Maybe you could open up like an online store or something. So yeah, maybe that will be my backup plan.
So you'll be doing the fashion,
Yes.
the crochet fact. Love it. I've put together my little utopia. Alrighty, so there are many people who are watching this wonderful conversation that we've had, Dr. TK, and they're wondering how can we connect with you? How can we find out more about you? And if there are any ways that they can support you, they'd love to be able to do so. So let them know, where can they find you?
So I unfortunately only have two, well now three, including LinkedIn, social media platforms. So I only have WhatsApp because that's like my main mode of communication with my people, and Facebook. So on Facebook, Thakgalo Thibela. So Tahi is just the short version of Thakgalo. Um, and on LinkedIn, I'm Dr. Thakgalo Thibela.
Lovely, lovely, lovely. So if you want to get in contact with Dr. TK, Dr. Thakgalo Thibela, you can connect with her on LinkedIn. That's how I found her. I'm like, I need you on my show. We need to tell everybody about the greatness that's out there. Love it, love it, love it. And if you want to connect with her on Facebook, say that again. That's Dr. Thakgalo TK Thibela?
No, just Thakgalo Thibela.
Okay, Thakgalo Thibela. All righty, there we go. So if you want to connect with her there, she'll love, love, love to hear from you. Let her know how she is doing, because I thought that this was a great interview. I had a lot of fun, and I'm glad that she did too. I can tell you did.
I did. I was so nervous in the beginning, but it just went.
I told you, I always have a great time with all of my guests because there's so much wisdom that's within the medical community. I love that I can get to share it with others and then get to share our lovely personalities that says behind this brains and all that we do. We're just humans who just so happen to love science enough to give away 8, 10 years of our lives dedicated towards it in order to continue doing that for the rest of our lives. That's just us. Yeah, we're just kind of semi-normal, right? We're unicorns. So thank you so much, Dr. Thakgalo, for jumping on with me and for taking this time out to share your journey and your story. I know that it's an inspiration to others who are out there who are looking, and also sharing the ups and the downs, sharing and being so transparent about the uncertainty and how it affects you, and even how you felt during your journey and experiencing burnout. And also the crocheting that you're about to do, because I'm looking for my dress. I'll give you my I'm looking for my dress. It's gonna be in the mail. All right. So do you have any last words for those who are watching before we end this great conversation?
I'm just really honored and I feel very privileged to have been with you today. And just want to thank everyone that took their time to watch this, to watch me. But thank you. It's been an honor, and I have really been receiving a lot of support. I wasn't expecting to receive this much, so I'm really truly grateful. It really has been helping me through this difficult time. Thank you.
All righty, love it. So thank you guys who have been supporting her. Let's continue to do so. We know it's a lot of years and a lot of strenuous years to get through medical school, and to do so, and to be able to do your passion, which is medicine. We want to get her back in that game, because we definitely need you and your beautiful brain. There we go. The beautiful brain. All right. You're a surgeon in Macon. So thank you so much, Dr. TK, Dr. Thakgalo. And I want to thank you guys who are watching. Now, I know you've been watching this and you're thinking, oh my gosh, I just got part of this broadcast. And I'm like, no, you didn't, because the entire thing is available on our Your Caring Docs website. So just go to urcaringdocs.com, click podcast. You'll see Dr. Thakgalo's beautiful face. Click listen here, download that episode, and share it with all of your friends. If you want to share it with someone in your life who is inspired and wants to do medicine, let them know. We'll learn about the good, the bad, and the in between, right? Now, there are some of you who are like, okay, wow, you guys talked about stress. Yes, med school is stressful. Oh, emergency. Yes, it is stressful. Dr. Thakgalo, she's doing her first suturing in the ER. She's wondering if she's doing a great job. And she's doing her rotation on January 1st. Absolutely wonderful day to start working in the ER. But if you are looking for a dynamic speaker to talk about stress management and burnout prevention at your next event, I am the person for you. Send me an email at drbeckford@yourcaringdocs.com. Let me know you are looking for a dynamic speaker, and I would love to connect and make your next event a dynamic one. Alrighty. Thank you so much, Dr. Thakgalo, for joining me today and for blessing us with your journey. We wish you all the best and all the luck, and I hope to see you in person one of these days. All right?
Thank you. Thank you so much for having me. Really
My
has been an honor.
My pleasure. All right. Thank you all for watching. You guys have a great day.